Hi, welcome to another edition of This Issue. My guests this time are Wendy Flaschner and Bill Clarke, both with a group called Maine All Care. No one without care. Everyone is covered. So we're going to talk about Medicare for all basically today. Welcome to the show.
Thank you.
Glad to have you both here.
Great.
Thank you.
Would you each tell us about yourself and where you're from? Wendy, you want to go first?
Sure. I'm from Brunswick, Maine. I met Bill a couple of years ago and at a rally, I think, at the UU Church in Brunswick. We were all working on how to survive the Trump election. And Bill introduced me to this organization called Maine All Care. And because of personal and professional passions, I joined.
What was your profession?
I was a school psychologist. I'm now retired, and I worked 40 years in the public schools in Maine and elsewhere.
All right. And Bill?
Great, yeah.
I should say you've been on the show previously.
I've had a good time on the show, and I'm happy to be back. I live in Brunswick now, just for the past couple of years. Before that, we were in Woolwich, and I'm a retired internist and addiction medicine specialist, and I've been concerned about issues like this since I was in medical school. So I'm just terribly excited to be able to belong to Maine All Care and work on bringing health care to the citizens of Maine.
Why don't you briefly tell me more about that point you just made about being in medical school, and that's where you became interested in this issue.
Yeah, so in medical school I was interested in public health, preventive medicine, and when I graduated in 1965, Medicare was passed. And I said, along with my colleagues, hey, this is great. We have health care for all of our elders. Pretty soon we'll have it for the rest of us as well, but we're still working on it.
How many years ago was that?
Oh, wait a minute. Do I have
All right,
to do
you don't
the
have
math?
to tell. Okay, so let's hear more about Maine All Care.
Sure.
What does Maine All Care advocate and why?
Yeah. We're a 501c3 organization. We're just supported by our supporters, currently 36,000 of them in our database, and we're always trying to add more.
That's just in Maine, right?
That's in Maine,
Yeah.
just in Maine, yeah. So what we advocate is universal health care, coverage for everybody, publicly funded. That's the bottom line, and that's what we're sticking to. So we're a single issue group.
Publicly funded. How do you publicly fund such a thing?
Well, I think of it as a public good like schools, libraries, fire departments. So no one wants to hear the word taxes, but healthcare is as important as all of those things. And we believe, like other, maybe 36, I think it was, 36 other industrialized countries have provided healthcare for all of their citizens. And we believe that the state of Maine can do that as well.
You want to say anything on that?
It's just that basically healthcare should be a public good, and we should fund it the same way we fund other public goods. And that means everybody pays and everybody benefits. And you pay according to your ability. You don't pay when you're sick. You pay when you're well. And that's a huge difference from our current system.
And it wouldn't be as expensive as health insurance is now, right?
Well, when we talk about how do we fund this, we also have to say there's enough money being spent on healthcare right now that we could cover everybody with that money if we redirected it away from corporate greed and profits and started saying, hey, we need healthcare, we don't need more profits.
So most countries around the world have nationalized health care, as you just said, 36 other countries, including poor countries like Cuba and many others like that. So why don't we then, either at the federal or state level, have this kind of national health care for all? What's holding it up?
It's a really good question. I don't really know the answer to it other than I never thought about health care. My story is that I just got it through employment like everybody else. But all of a sudden, when someone loses their job, and in this case it was my husband, and we used his insurance, like many married people, you go on the one plan that's the best. And when someone gets sick or loses their job, all of a sudden you are without health care. So a lot of our insurance plans are tied to employment. So that's one problem we face. Secondly, the healthcare industry, insurance-based companies, as Bill had said, are all profit-driven. So they're in charge of what you pay. And if you can't pay, then you're without insurance. So it's tied up with employment and greed, profit, whereas schools don't make a profit.
To speak a little more directly to why we don't have a system in this country, I think there are four major reasons, Bruce. It's
Greed, and greed.
Yep.
well, that's number 1, 2, 3, and 4. But the others are corporate money, tax phobia, political timidity, and lastly, a worry that many people share about scrapping a system which is broken but very familiar. So people don't want to give up. They don't know what they're going to get, they think.
Yeah. They want to go with the known, even if the known ain't so great.
They're worried about choice, mostly.
Yeah.
Choice, coverage, and accessibility, none of which we really have anyway, in my opinion. But they do worry, the unknown is scary.
Well, so basically you're saying that the insurance industry controls the healthcare situation. So solutions getting through Congress are problematic, right?
Right.
It's
So-
not really. So how does the insurance corporation, the industry, really control Congress? Can you give some examples of how it
Yeah.
works?
It's pretty simple. It's called dark money. And the facts are that Big Pharma is the example I know best. Big Pharma has 2 lobbyists full-time in Washington for each congressperson. Okay, that's over 1,000 lobbyists who are full-time talking to the representatives and the senators about what really should happen.
Paid lobbyists.
Of
They're
course, highly paid lobbyists. So that's where a big chunk of people's insurance premiums go, to pay the lobbyists to keep the Congress people from changing the healthcare system.
And how do the lobbyists, how do they keep these politicians under control? Because I know the politicians are hearing from people back home that are not happy with the way things are going. What influence do these lobbyists have over the politicians?
Here's the problem. Healthcare is a very complicated system that's been sort of built up over many decades in a haphazard kind of way, sort of key points after the Second World War, when you couldn't raise people's wages by law because money was going in other directions, and so a corporation started offering health insurance, and then we had Medicare. So it's a very complicated system, and all the lobbyists have to do is convince the Congress people that changing X or changing Y or changing Z would be bad for their constituents. And they don't really have to convince them. They just have to say, people would worry if you do this, which is what I was saying about anxiety over changing a system that's familiar but broken.
And how they do that is they show up. So when we go to the legislature and testify with our stories and our concerns as constituents, they show up in numbers. And they are paid to speak as the opposition. And they're very, very convincing. I just had an experience 2 weeks ago, but with someone from Canada who stood up opposing our position of universal health care because it'd be like Canada and we wouldn't be able to cover everybody because there'd be a shortage of this or that. And he was very eloquent in his three-piece suit, and the legislators were listening to him as much as they were listening to us. And so it's just a battle back and forth, but it's a difference in values.
Well, Wendy, it's not a battle back and forth because the lobbyists are full-time talking to the
Right, so
legislators.
it's not equal.
We go up and testify when it's our turn to talk to the committee members.
Right.
But
Plus, don't the lobbyists also deliver checks to the politicians?
I forgot about that part. Absolutely. That you could say that the politicians are in the pockets of the insurance industry and Big Pharma.
It's what the Native Americans called green frog skins, by the way.
Really?
They said that the white man was blinded from reality, from seeing the truth of the world by his love for the green frog skin, the dollar bill.
Yeah.
So
yeah,
this-
and that goes way back in our history. I mean, we're still fighting that battle.
Yeah,
Yeah,
the power of moolah, as
Yeah.
you'd say.
yeah, exactly.
Wow. So it's a naughty system, naughty in many ways.
Yes.
But what's the current status in Augusta then
Yeah.
of your effort to pass legislation that would cover everybody?
Yeah.
Where's that at?
It's advancing, which is very exciting. Last year, Heidi Brooks from Lewiston, a representative from Lewiston, introduced a bill that said we should cover everybody in Maine. It didn't have many details in it, except for what the coverage would be. That was LD 1274, and the committee, I think it was Health and Human Services, no, it was Insurance and Financial Services. The committee, split evenly between Democrats and Republicans, voted unanimously to pass the bill. So it was a concept bill, so it doesn't get voted on by the entire legislature, but what it says is we need to work on this. And it was a terribly exciting thing. So one of the things that came out of all that activity was renaming the Insurance and Finance Committee, and now it's the Health Coverage, Insurance and Financial Services Committee. So the legislature has started to respond. And in this session right now, there are several bills introduced that we support that advocate coverage for every Mainer, publicly funded. And we testified at committee hearings last week, was it?
In the last
2
couple of
weeks?
months, yeah.
At the legislature, and they're thinking about these bills, and it's very exciting that they're moving ahead. And they know who Maine All Care is. They want to know what our opinion is, and we are currently plural we, which are the experts that they call on when they're not talking to the insurance industry.
I guess it helps when the public picks up the phone or writes a letter or sends an email to their either their congressional delegation in Washington or to the state reps and senators in Augusta. I suppose that really helps a lot, doesn't it?
Well, one of the activities that I participate in, because I like to talk to people about this, is Get Supporters, and it's a public awareness initiative. We have 14 chapters in the state. It is state-focused. We're very much focused. That's why we stay away from Medicare for all. It's really universal health care for Mainers, because we're just focused on a state-by-state initiative. And it's really public, as you say, getting the public to be informed, and then, yes, to lend their voices to their senators and congressmen.
Now, some would say Maine's a poor state, which is true. How would we pay for such a thing in this state?
Well, right now we have a mess of options, from community health options to, which is Affordable Health Care Act, to Cigna, Blue Cross, Harvard Pilgrim, and the premiums and copays and deductibles that we all experience, those of us who've had insurance companies and plans, if we got rid of those three things, no copay, no deductible, and no premium, and everyone pays in as we do for Medicare, those of us 65 and older, we could pay for it, because you would lose all of the administrative chaos.
Yeah, because every insurance company has an administrative thing, and so there's all kinds of duplication, right?
Yeah, there's an incredible amount of waste and profit in the current situation. And what you do is you say, look, there's a public good. It's not a corporate good. It's not, we don't need healthcare to help businesses do well. We need healthcare to make people healthy. And it's very clear that with the amount of money we now spend, we could cover everybody. So, in fact, by redirecting those funds, it turns out that most people would pay less than they now pay but they wouldn't be paying it in premiums, deductibles, and copays, as Wendy just said. They would be paying it in a small premium that's based on your income.
You know, in the state of Maine, one of the largest employers is Bath Iron Works and LL Bean or the government. And those people who were working for them are basically in a single payer system because they're in that huge pool of workers. And what we want to do is extend that to everyone else. That's what we mean by everybody in, nobody out. And if you're not at Bath Iron Works and you don't work in the schools or the government, you're in one of these other plans that, you know, have very high deductibles. I have a $8,000 deductible every year.
Wow.
So if something happened to me, which it's going to, everyone has a health crisis in their life at some point, I have to come up with $8,000 a year.
You know, I'm in the VA system. I'm a veteran.
Exactly, good point.
And I have to say the care has been fabulous. And every time I go to Togus for care there, I always feel so supported and everything else. But I always feel a little guilty because I walk in, I don't have to do anything. I just walk in, I walk out, I get great care. And I say to myself, why am I so lucky? Why doesn't everybody have it this way? Why can't everybody have this kind of system?
So let's do a little education and start to respond to one part of that question, Bruce, which is the right question. You know, if you're privileged, how come the rest of the world isn't in this country, this very rich country of ours? So let me just point out that the number one principle for Maine All Care is universal coverage. And I want to talk for a second, make several points about why universal coverage is such a key point for Maine All Care. It's because everybody would win once we get into a universal coverage situation. If we talk about employees, you know, you could leave a job you didn't like and get a better job.
Yeah.
No job lock. Right now, if you leave a job, you're out of luck for health insurance, you know, and you might or might not get health insurance at your next job. So everybody who's employed would be a winner. Secondly, big business would be a winner, like BIW and Beans and so on. They wouldn't have to dicker with insurance companies every year and pay somebody on their payroll to deal with the insurance companies. They'd be free of all that. They would be much more competitive in international markets than they now are, and workman's compensation would be greatly simplified because injuries would be covered, period. You know, so small businesses would do very well because they could be entrepreneurs. They could set their sights on innovation and finding the best workers instead of worrying about why they can't pay themselves health care or they can't hire employees who have health insurance. Hospitals would be a lot better as well because they would benefit greatly by not having charity care anymore and not having to figure out 65 different ways to build different insurance companies for different services.
Right. So why do hospital and drug costs keep rising? That's all we hear about is that the costs are going up, the government's got to do something about it, but nothing ever seems to happen.
Greed, profit. You've heard the stories, I've been on the news, and they're talking about the amounts of millions and billions that their CEOs make. I mean, as a lay person, that's what I see as the problem. It's greed.
Bill, anything from you on that?
So about hospital and drug prices, it's clear on the drug end, and it's very much in the news right now, as Wendy is saying, that the pharmaceutical industry has conspired to keep prices high and to raise prices so that the money goes into their pockets. At the hospital level, it's a lot more complicated. Prices are high because you have to bill for every service. Every aspirin has to be billed for. Has to be directed to an individual patient account, and so on. It's nuts. So, as the people from Canada say when they come here, you know, in our hospital we only have one clerk, and it's very hard to find that clerk who takes care of the billing. In our hospitals, like at Mid-Coast here in locally, there are dozens of billing clerks. That's all they do. And so the cost for the hospitals is just really sky high for a whole lot of different reasons. And although we call hospitals not for profit, if the hospital makes more than they need to spend for those Band-Aids and aspirins and so on, what they do is expand. They build a new luxury suite, and then they get more business. So profit in the nonprofit institutions is important.
All right. Well, thank you both for coming on the show.
So much more to say.
Yeah.
Thank you
So
for
much
having
more.
us.
Yeah.
Absolutely.
Yeah.
And thank you for watching another edition of This Issue. Until next time, good luck to you all, and please get organized.
Make American healthcare for all. Make American healthcare for all. An emergency room, a doctor, a nurse, just what you need since you're feeling worse. But now you're laid up and you don't have a dime, and you might not get there to see them in time. Oh, make American healthcare for all. Not just for the rich who shop at the mall. Bankruptcy, homelessness, insurance tricks. Temperatures are rising, but the healthcare is sick. The French, the German, Japanese, and the Swiss enjoy healthcare without financial risk. But if you live here in the US of A, who's gonna care for you if you can't pay? So make American healthcare for all. Not just for the rich who shop at the mall. Bankruptcy, homelessness, insurance tricks. Temperatures are rising, but the healthcare is sick. As children we learn the moral commands, to care for the weak, to give helping hands. Our Pledge of Allegiance calls us to stand with liberty and justice for all in this land. So make American healthcare for all. Not just for the rich who shop at the mall. Bankruptcy, homelessness, insurance tricks. Temperatures are rising, but the healthcare is sick. Make American healthcare for all. Make American healthcare for all. Make American healthcare for all. For all. Make American healthcare for all.